Leo tumekuja kwa mambo ambayo ni mazito sana. Think pink?
Go out.
Think pink?
Go out.
Think pink?
Go out.
Hata tunajua kuongea. Umesikia vile wanapiga maneno huko, wanasema think pink, go out. Hii ni breast cancer awareness. Yaani saratani ya matiti. Ni saratani ya matiti. Ya matiti,
Yes.
Lugha nyingine mzuri ya matiti ni gani ndugu yangu? Iko sawa, So tunasema tumekuja kwa breast cancer awareness. Hii ni janga ambayo imekuwa ikishika watu wengi, imekuwa ikihangaisha watu wengi. Wengine wao watake kuiongea kwa vile wanaona ni kama ni jambo ambao ni aibu, wengine unajua na ni kitu ambao ni mnyama ambao inaangamiza. Lakini kuna solution ya kwamba kuna vile unaweza kuishi na hiyo janga, na at the end of the day kwa mapenzi ya Mwenyezi Mungu Subhanahu wa Ta'ala uongezewe maisha mare. Think pink?
Go out.
Think pink? Go out. Wacha niwaachie Mdosi aongea hapa. Mdosi njoo uongee. Huyu sasa ndo mambo yote mwanangu. Huyu sasa ndo ana organize initiative kila kitu na nini. Mwambieni, unajua sijui ataongea Kiingereza, aongee Kiingereza mwanangu. Ndio?
Kiingereza.
Kiingereza.
Okay, maybe you can introduce yourself.
Yes, I am Michaela Mongura. I am the director of Eminence Global, our communications company. We have organized this nationwide campaign for breast cancer awareness to create more awareness around breast cancer, to advocate for early screening, because it's the number one killer cancer in Kenya, And so because of that, we have to raise awareness around it. And we've brought together leading companies and organizations and NGOs that have partnered with us to show benevolence to the society, to show their support in CSR, and also to stand in solidarity with breast cancer patients and organizations that are fighting to be able to one day to have pink just a color, not just a color to associate it with cancer. All right. Yes. So that's why we are here today, to unveil the activities we're going to have this month. And one of the activities that we're going to have is the Pink Run. It's going to be on 19th of October. That is next week, Saturday. So that's when we're going to have the Pink Run here. It's 5.5 kilometers. It's going to start at the Hub Karen and end at the Hub Karen. After that, we're going to have the Pink Visit to a cancer foundation to be able to understand their challenges, their needs. Most of them, they need prosthesis. Most of them, they need support from families and friends and relatives, and also community in Hollywood, So we need to go and visit and find out what do we need to do as a people, as humanity, to be able to support them. Another one, we're going to have also the breast cancer pink banquet at the JW Marriott on 31st of this month. And during that day, on 31st, we're also going to have Scars to Stars. And of course, later, the director of Kenco expound more about that, and also the other activities that we have in the course of this month. But the main message is to think pink, go act. Whenever you see the color pink, you have to inform your sister, your daughter, your partner, your wife, your female friend to go for early screening. So during that day, on the Pink Run, we're going to have free screening here. We have our different hospitals that are going to come to pitch here booth for free screening. So we urge all women to show up in large numbers. Not only women, also our brothers, our partners, our spouses, our husbands, our male colleagues to come and stand in solidarity with the women, with all women, and encourage them to come and get screened. All right? Yes, so that's why we are here today. And today also we have breast cancer survivors who are here with us. There are 3 of them. I'm going to call them so that they can be able to share their journey and what is it like to get treatment in Kenya, and what we can do different as a country to ensure that every single patient of breast cancer actually is able to go through the treatment process smoothly until they attain healing.
Yes. Tuko na mashujaa.
Yes.
Mashujaa ambao wajaogopa kusema ya kwamba wako na saratani ya matiti. Nimekwambia watu wengi sana wanakaa wanasema kwamba labda nikisema kuna vile itakuwa. Wao ni mashujaa, wamejitokeza, wamesema ni ugonjwa kama ingine na inaweza kukua na suluhisho. Na Mungu ndo anapeana maisha, sio binadamu. Mungu anakupa maisha, hata kama umebeba saratani unaweza ishi paka uishi uone watuku na vijitu. Wacha nikaribishe shujaa. Karibu sana. Karibu. Huyu ni shujaa. Huyu tunamcelebrate. Wewe tunakucelebrate. Wewe tunafaa kukupea convoy, tukupea kingora kwa sababu wewe umesimama imara na asante sana.
Since you said go act, can you act right now? Let a convoy. Na hizo vitu zote umesema.
Umepata tayari. Chawa rais amesema haya.
Asante sana. My name is Lucy Njeri Kariuki and I'm breast cancer champion, thriver, conqueror. We give ourselves such names. We don't call ourselves survivors because everybody is trying to survive this Kenya. This is my 8th year after diagnosis. Mimi ni mama wa matiti moja. Ni matiti ama ni titi? Haya, mimi ni mama wa titi moja. Nilipata saratani mwaka wa 2017, nikaingia pale Kenyatta, wakatoa titi moja, wakafanya chemotherapy, nywele ikaanguka, lakini sasa hebu cheki.
Wow.
Ikarudi, nikafanya radiotherapy 20. Na wakati huo, acha tusemage tu kweli, NHIF ilikuwa inalipa ama ilikuwa inalipa? Ilikuwa inalipa, lakini saa hizi problem sida kubwa sana. Lakini kwa huo wakati I'm grateful. It did cater for my treatment at Kenyatta National Hospital, and today I'm here redefining cancer. Cancer is not a death sentence. We have survival, and we are asking for a piece in the pie. Wanakuanga na diagnosis na death. So tunataka diagnosis, survival na death, because we are not featured, and we are the voice who can give the story or paint the real picture when you go ground. Na kwa saizi ground si poa. But we're still giving hope against hope. Tunasema kuna maisha baada ya saratani na kuna uwezekano, na Kenya kuna madaktari sababu nimetibiwa hapa Kenya. So I advocate for local treatment. I don't advocate for medical tourism because I got my treatment here and I'm well and standing. So our doctors are well and able. And our institution, we just need to affirm 3 things, one here and there, and things could be working. When I was getting treatment, Kenyatta was the only hospital. But now, let's give credit where it is due. We have a cancer center in Nakuru, so people are not coming from Nakuru to Kenyatta. We have a cancer center in Mombasa, so people are not coming from Mombasa to Kenyatta. We have a cancer center in Garissa and Machakos. So serikali hata kama tunawachapaga hapo mmefanya vizuri. Mmefanya vizuri na tuko na pia na KU na wameleta madaktari na manasis, and there's a lot of fellowships for those girls who are sharp upstairs. Mimi nilikataa kusoma nikaorewo. So those who are upstairs, they can do medicine and help our people. And we're also saying that we integrate the cancers. It's the same woman who has a cervix. So when you go for screening, get your cervix screened, get your breast screened, and the NCDs, diabetes, hypertension, nini lingine inakuwa non-communicable? Pressure, because it's the same client. So when you go to that, when you go for screening, you ask to be screened of those other, because you're having people who are recuperating from cancer and then they die because of depression, diabetic, and it's so unfortunate. So let us widen our screening. Mnataka kitu kingine? Niwaambie.
Maybe utuambie challenges zenye ulipitia ukiwa with the breast cancer thing.
Challenges, there are many. Losing a body part is not just another thing. So mentally and emotionally it was draining. Yeah, I had my breast removed, and even today I asked, why did they take my breast? It was part of me. So I still mourn my breast. Naturally, when you lose something, I was not born without both, or rather I never grew up without any, but I lost one in the process. So that is one that affects patients, trauma, emotional awareness and mental awareness. Challenges, I had a small baby. So where to leave my baby when coming for treatment? Queuing in Kenyatta, but as long as I queued and I got the services, I'm good. We say that Kenyatta itakangi makasiriko, you go and queue like everybody else, get the services, yes, and you stand. You leave your makasiriko outside the gate, and in Kenyatta we don't have my oncology, we have our doctors, because they are there to hudumia all of us. Another challenge, simunana niko na socks. I've developed something called lymphedema. When they remove the breast, they remove the lymph nodes. And they are responsible of transporting the liquid in my body. So if you lift anything more than 20 kgs or you work, ufue manguo, unapata lymphedema. Hii sleeve ni 5,000. Hebu ndapata kwa bag yangu ulete matiti. Nionyeshe kenye nimeweka na brad hiyo hii hapa.
Prosthesis.
Ndio hii hapa.
Yeah.
So what to rehabilitate you see I have a cleavage.
Yeah.
Ziko poa?
Kabisa.
Saa sita?
Yes.
Naweza pata mtu. Si ndio?
Yes.
So what do we do to rehabilitate ourselves? I want to show you. We use this.
Yeah.
This is a silicone one. This is the best quality. Why? Because it has weight. It also balances your mgongo. And then we have a specific bra that we use for that.
Oh, that's an option.
This is another one. This is another. This is the bra, the mastectomy bra. So you slide the prosthesis inside here. Let me show you. Yeah, like this, and then you rest it against your chest. So this is what we use for rehabilitation. This prosthesis goes for 45,000. So sijui ni Mkenya mgani after treatment, after treatment is going to afford to buy the prosthesis.
Yes.
This bra goes for 3,500. I don't know which Kenyan will be able to buy this. We have an alternative one. We have our survivors who are knitting this one. And this one goes for 1,000 bob. It has fiber inside and it is light. So we are asking, if I get in a hospital and I have my breast removed, can that hospital please cater for rehabilitation?
Yes.
Because I need to have my femininity back and my self-esteem rehabilitated.
Yes.
This is just part of the things that we also, when your hair falls, wigs.
Yeah.
During chemo, we need the wigs and even the koffias when it is cold.
Yes.
So we would ask, he or she, Nasha, our brothers, can they cater for this if they are going to come? Yeah. For any other cancer, let's say mkono mguu, they need prosthetic leg, prosthetic arms, it is out of their reach. And we are demanding to be given disability cards. When you lose a part of you become a disabled person. So I lost my breast. I need to be given that disability card and waived mpaka kwa tax. Si ndio? Na si kuomba, tunasema ni lazima. And for those who have hidden disabilities, we have a women who have cervical cancer and they have their hysterectomy removed. So they don't have part of their body. There are those who have used stomach bags because of colon cancer, but you can't see it. And we can't go displaying our disabilities. So please, can that be factored? Thank you for celebrating us. One thing I would want to say, don't just wear pink, don't just be happy, go for screening. Please, the best thing you can do for yourself this month is screen. Know your status. And then if you've known your status, whatever daktari is going to kuelekeza you to do, you just do it. And also advocating for the HPV vaccine for our girls for cervical cancer. We say cancer is just one, but you have different cancers. So if you have a girl who is 9 to 14, mpeleke apewe chanjo in the hospitals, government, it's free. In private is where they charge. If you can do something to support a cancer patient right now or survivor, please do. It doesn't have to be monetary. You can go and visit them. You can go and drink and dance with them. We have a walk in Mama Lucy on Saturday. Please, can I have this rain? They come in support of us. I'll be there so that you can see this the survivorship and we are there. For me, support system means a lot. It doesn't have to be monetary, but be kind to people. People are battling a lot, and together we can win it. Think, go Blacks! Thank you.
So we can have a Monica and say a few words too.
Okay.
I think Nani has said it all. Just
Okay. I'm a breast cancer conqueror or survivor or a winner, to mention but a few. And I'm happy because I made it and I came to realize cancer is not a death sentence. So I feel proud when I advise or I talk about cancer because I'm the one who have gone the way or the road who can be able to encourage the other women. Cancer is not an easy journey. Because it needs a lot of treatment. The treatment is expensive. When we come to think of chemo, if you don't have enough money, that's why we find people dying, because it's very expensive to have the treatment. From there we go for radiotherapy. It's also another therapy, and it also needs a lot of money. It needs a lot of money, and we find if you fail to do the radiotherapy, you might find a recurrence in your skin. So we can also request anybody who can be able to take care, or who can or who can grant anything to do with the cancer. we can feel he or she can be feel appreciated, because it is not an easy journey. We made it, and it's through God and through having other people for encouraging us. That's why. But I have experienced some people dying because of lack of enough treatment. Especially if you miss any chemo, you might find your body it's not making, so you feel you grow weak. And so I have experienced my fellow friends dying because of missing, especially when the doctors striked. I had 5 people who died on the line waiting to be done the chemo. So it was so hurting when we see those important services being failed for some people, like cancer people, and like the other, like wenye wanaosha damu wanaitwa aje, the dialysis. So tunaomba sana hizo vitu, hata kama kuna mashida mingi, watu wa kansa wanaangaliwa, services zao zinakuwa asisimami. Hata kama kuna mashida ya daktari wakitoka kwa barabara kusema wanataka misahara na nini, wakumbuke kuna watu wanafaitia life yao, because if you fail to do chemo, problem inaanza hapo. Me, I'm an experienced person. Niliona watu wakikufa huko KU. Mimi nimetibiwa KU na I still have that pain because I saw them, and later I came to be called that wamekufa sababu ya kukosa chemo wakati doctor walikuwa wamegoma. So tuko hurted sana. Hiyo ni kitu ilinifanya nisikie vibaya hata saa hii, because they were my friend and they wangesa 5 isipokuwa ni venye walikosa chemo. Kuna swali?
Utonge
kidogo.
Sawa, asanteni.
Ongea tu. Mimi naongea sana. Okay. Mimi naitwa Wambui Egra. I'm a Survivor champion since 2021. Hii ni mwaka yangu ya 3, and I thank God for that. Ile kitu ningeongezea juu ya hiyo marafiki wangu wameongea ni after cancer watu hawaangaliwi. Tukishatibiwa kansa, mnaona sisi tumepona na tunakuaga tumepitia mambo mingi sana, na hiyo wakati ndio tunakuwa tunataka nyinyi ndio at least tukue strong na tukue na hiyo strength ya kuenda na mbele na hii safari. So ukishamaliza chemo, radio na nini, kama mimi sasa niko in hormonal therapy. Hormonal therapy ukifanya unakuwa na a lot of challenges, kama kuumwa na mfupa, kuumwa na miguu. Hizo ni kama morning sickness, like ni kama uko pregnant, you know. Sasa mimi naweza omba mtu anaweza saidia wale watu wanafuatilia hii mambo ya kansa, wawe pia wanafuatilia wale watu wametibiwa kansa na wamekuwa champion. Juu huku ije kuna champion wengi sana, after kufanyiwa hizo vitu zote the family inabaki haikutaki, watu wa kijiji hawakutaki, kwa sababu wakiona simu zako wanafikiria you need money. You know, when you fight cancer most of the time you use money. Na unatumia pesa mingi, unatumia pesa yako to the end, mwisho ya maneno unaanza kutumia ya marafiki wakiona simu ya Egra, ona huyu anatupigia simu, ni ile tu mambo yake ya kansa. So tunakuwa ni kama tumeachiliwa, tunasikia hatuna nguvu. Naweza omba sana wale watu, hata serikali yetu ya Kenya iwe inafuata hiyo maneno. Kitu kingine naweza sema ni hiyo mambo mmeambiwa ya NHIF. Wakati mimi nilikuwa nafanyiwa chemotherapy na radiotherapy na amestomy, nilifanyiwa huko KU na NHIF for real ilikuwa inalipa. But for now tukikuja isha, hakuna kitu inaendelea kwa mahospitali zetu. In fact, watu wamekaa huko nje wanahangaika. Kama hivyo nimekuambia mimi niko kwa hormonal therapy, hata hizo hormonal 1 tablet is 400 each. Na unaambiwa uende ukanunue kwa kila siku, na wewe ni hasara kama mimi, utatoa wapi? Kwa hivyo hiyo kitu pia tunaweza taka serikali yetu haswa wabunge wetu waachane na mambo mingi ya perepere mingi, waangalie watu wa ugonjwa ya kansa. Hiyo ndio kitu tuliwatumia bunge hii wafikie, because I'm very in pain. Hii wafikie, waache mambo ya mdomo ya nini, hiyo mambo ingine yote wafanye, lakini waangalie wagonjwa wa kansa, kwa sababu wagonjwa wa kansa wanakufa, na wagonjwa wa dialysis, unajua ukigojeka ugonjwa ni ugonjwa pia, hiyo dialysis huko watu wanakufa sana. Wafikiwe na hii ujumbe, msikubali wakose kusikia, waseme watu wa kansa wanalia huku nje na wanakufa kwa sababu hii shaa haifanyi kazi, na tusipokunywa hizi dawa tunapata recurrence. Kwa hivyo sasa mimi nikikaa 1 month bila kutake the medicine na ngojea recurrence. Yeah.
Okay, I can talk about the statistics. Okay, so thank you very much. This is Kenyan Network of Cancer Organizations. We are here in solidarity with Go Pink, Go Act. As the survivors have said, breast cancer is currently the leading
cancer in Kenya as far as incidence is concerned, and it is the second leading in mortalities. That means that every year we are seeing about over 7,000 women diagnosed with breast cancer, and every year we are losing over 3,000 of them. Now, one of the main reasons why we are losing these women is what we call late diagnosis. So in Kenya, it is said that only about 16% of women show up for breast examinations, especially the clinical breast examination, and only 30% of women have ever done in their lifetime between the age of 15 to 49 have done what we call the self-breast examination. So we are urging people to come out in large numbers in this month of October, get screened, get tested. Even yourself in the house, you can do what we call self-breast examination. So as Kenya Network of Cancer Organizations, also what we do is that we support the survivors by what they have mentioned. We have the prostheses for the breast, the wigs as they lose their hair. And by the way, even when they lose their hair, the hair that comes back is very full and very healthy. So we are here to encourage those who are currently going through treatment. Do not give up. It is going to be better. There's good treatment in this country. Show up for treatment. And right now, breast cancer is not a respecter of age. In the recent times, it was mainly recorded among the older women and the older population. But now we are seeing the younger women, ages of 30, 25, 28. So you're never too young to go for a breast cancer screening, and you're never too old to go for breast cancer screening. So the theme for Ministry of Health this month, in addition to Go Pink, Go and Act, we are talking about closing the care gap and then making sure that there is access of care and support services and support for breast cancer patients who are battling. So thank you very much, and we are in solidarity. On 25th, we'll be in Westlands. We are having a medical camp. We are screening everyone, including the men. And also on 31st, we are having a Stars to Scars event that we are also inviting you to be part of. So we are here in solidarity with Eminence Global, and we really appreciate the work that they are doing for spreading awareness in this month of breast cancer awareness. Thank you.
Sawa, acha tufunge ndo tuendelee. Haya. Watu waamuka tupige ya mwisho sasa na psych, by the way. Psych. Wazito. Hata kama umejua SMS ya kuputiwa amuka.
Interview nini imesha?
Nataka kupiga hiyo think big act nini afu tufunge.
Okay. All right. Can you stand?
So ndo tukue na psych hiyo think big nini think pink go on. Mwaka ya watu kupima kitu inaitwa nini? Cancer. Na wanaume wengi wanagonjeka cancer. Hata wako na ile inaitwa cancer nini?
Breast cancer. Wanaume wako na breast cancer. Dumetelezi.
Oh, so cancer saratani ya wanaume inaitwa ndume telezi, ya kwamba uko chini na uko na shida. So kitu nataka kusema, serikali ya William Samoei Ruto wapea watu wawekwe kwa kitu inaitwa person living with disability. Yes. Unapatia pointi? Kwa sababu hao wanaumia hata kushinda wale wenye wanaishi person living with disability. Wapewe kitu inaitwa inaitwangaje kitu nimesema watolewe ile kitu inaitwa tax. Watu wa tax, watu wa cancer wasilipe tax. Saratani mbaya mwanangu Ali. Saratani mbaya ndugu yangu. Ikikushika hapo ndio utajua kweli saratani nini? Mbaya. So tunasema serikali ya William Samoei Ruto na wabunge ambao wanasherekea wakipiga kelele kwa bunge ni ya kwamba waache kuconcentrate maneno ya kusema impeachment, wa concentrate kupitisha mswada kwa bunge ya kusema kwamba patients wa cancer wapewe kitu inaitwa waiver. Unapatiwa pointi? Watu wa dialysis wapewe waiver. Na hata kama vitu zingine zifanyi kama NHIF, lazima wa concentrate waweke kwa watu wa kwanza ni watu wa cancer na watu wa dialysis. Unapatiwa point? Hizi ni za ndani shekhe, hii inaingia mjini. Hii inaingia CBD mwanangu. Hizi ni za ndani. Haya, think big.
Go up.
Think pink.
Go up.
Think pink.
Go up.
Think pink.
Wanaume pia wanapata saratani ya matiti. 1% of the population of men also get saratani ya matiti. So it is not a respecter of gender. Yes. So kama mwanaume uko hapo nje, usiogope, come out and get treatment. Early detection saves lives.
So before we finalize, I'd like to thank all the partners who have come on board to make this day a success and to make this month, the campaign, also a success. And one of them is the Hub Current for providing us this platform. They're also one of our major partners who are trying to show benevolence to the society in various CSR campaign. So we thank you, the Hub Current. We thank also KENCO, the Kenya Network of Cancer Association. Yes, we want to thank them so much for coming on board. We have other organizations like NCA, National Construction Authority, that are going also to come and participate for the run. We have the Kenya Red Cross. We also have AMREF team and also other universities that are going to come and participate for the run. So what we are telling you, please register for the run at register@eminenceglobalpr.com, register.eminenceglobalpr.com, and come for the run. Come and we stand in solidarity. You've seen it's not a respecter of gender or persons, okay? So whether male or female, come, get screened for free and know your health status, all right? So we want to finalize. Come on.